Hi everyone, my name is Wendy, and today I'm going to talk about my personal philosophy of healthcare and nursing. I've always thought a lot about social justice ever since I can remember, and my interest in healthcare comes from that angle. Um, I believe that healthcare is a human right. I think that everybody deserves the same chance to get well and stay well, and that's not a reality today in this country, and I think it's a travesty. So I work from that. I also think it's important to recognize the really vital roles that good nutrition and enough sleep and effective stress management play in health. And I think it's important to look at the reasons why people aren't getting these and to work on solutions to that, both individual solutions for our patients and systemic solutions, um, so that people can get these really important foundational pieces of health. Um, I believe that what we need to improve health care and health in general is not just bigger hospitals and more nuanced medical specialties and more technology. All those are important. But I think even more important is that we need to really focus on getting people really truly nutritious food and teaching people what that actually means, and and working for clean water and clean air and a functional mental health care system, um, meaningful support of children in schools, um, protection and nourishment of wild green spaces. I think all of these are really important. I think they're really important parts of healthcare that aren't really always included in our current conversation about how to improve healthcare. And I think they're vital. They're vital components, and I think they need to be bigger part of the conversation. Um, in general, my philosophy on healthcare arose from a place of becoming really aware of how inaccessible healthcare is for people with no money. I spent a lot of years as a young person without um, a lot of resources, without a lot of money, and I used the poor people's healthcare system for a lot of years. The patchwork of charities and vouchers and low income clinics and um, the number of resources is always grossly inadequate for the number of people who need those things. Um, and I was outraged that people with who had money could get substantially better healthcare than I was able to get as a person with no money. And I saw the medical system as kind of an outgrowth and symptomatic of the larger system of capitalism that really values profits over people, um, as kind of a rule. So I felt really powerless about that, but I wanted to know how to keep myself and other people healthy who, like me, did not have resources or access. And so I started studying herbal medicine. I'm 39 years old. I've been studying herbal medicine since I was about 20. And I started learning about plants and learned how to make medicine from plants and teaching other people how to do that. And I eventually went to school for herbal medicine um, down south where I'm from. And when Hurricane Katrina hit New Orleans, I went down there um, to support a medical clinic that had been founded in the wake of the storm. It was called Common Ground Health Clinic. And I went down there as an herbalist, and I worked with a lot of doctors and nurse practitioners, physical therapists, and nurses, and acupuncturists, massage therapists. There were a lot of people down there working and helping, and so I saw a lot of craziness down there, and I, um, I saw really firsthand how generational poverty and institutionalized racism really collude to keep people unhealthy. You know, they really impact, obviously, as we all know, the health and the well-being of people, families, communities, and it, it really like evolved my philosophy to include not only a class based analysis, but really an anti-racist analysis as well. So I decided to go to nursing school down there in New Orleans. I ended up living there 7 years and working at the clinic and going to nursing school because I wanted to be a more effective healthcare provider. I love science, wanted to have more tools to help people, and I also wanted to be a bridge between holistic and biomedicine, help people navigate those systems and get what they need. So I live in Eugene, Oregon now. I'm a telemetry nurse. I love my work, and I'm also a volunteer with Occupy Medical Clinic. It's a free mobile clinic, weekly clinic, and we serve folks who don't have homes and other people who don't have a lot of resources for healthcare. So yeah, I love what I do. I'm excited to explore nursing ethics with y'all. It's something that I think a lot about, obviously, and yeah, I'm looking forward to it. So thanks for listening and have a great day.